welcome to the Dental Handoff. I'm Dr. Kelly Tanner, and today I again have with me Barry Bartusiak, who is a dentist, and we talk about different topics that are leading up to some of our courses that we provide for on behalf of Young Innovations to help you and the operatory and help you connect better with each other and with your patients. And on this episode, we are talking about high-tech, high-touch, the importance of this in the team, how to keep us motivated. And, you know, so many dentists I have heard, even before COVID, honestly, would say, okay, what's the importance? Why am I going to send my team and spend X amount of money to go send them when they just might quit? Okay. What is your response to that?
Doctor, retire. Find another profession. Grow apples, something.
So, I mean, but that's such a scarcity mindset.
Yeah. You need to, I love what you just said, because you have to deal from abundance.
Mm-hmm.
And there's enough, for everybody, and we have to deal from abundance. And talking about high tech, high touch. So, doctor, leave your operatory after you do a case presentation, or you talk with Mrs. Jones about needing this, that, or the other, and go around the corner. And here's what happens every single time. They turn to the assistant or the hygienist and they go, "Hey, Kel, this was your mouth. What would you do?" Every time.
Mm-hmm. Yeah, it's true.
There's your case acceptance. So if Kel goes, "Wow, you're not going to put a screw in my mouth. You're going to do any implants?" No, because she doesn't believe in that.
Mm-hmm.
She's not a part of that. So if you're a high-tech, high-touch provider, you have the right tools. You have the right training. A rising tide raises all ships.
Mm-hmm. And
so then, guess what, teammates? Rising tide raises all ships. Your bonus goes up because a rising tide raises all ships. Your happiness factor goes up.
Mm-hmm.
You attract more new patients. You're busier. It's all becomes a win-win situation, and that's what it has to be. I mean, you've done it. You probably have been in an office a time or two where, you're using a hammer and a chisel to,
yes,
because that was the tool of choice, versus high-tech instruments that allow you to not only provide superior care, but also save your hands, which is extraordinarily important.
Yes, yeah.
And that made you feel loved, didn't it?
It did. And I was so blessed at an early age to, it's just funny because I guess I attracted dentists into my life that believed in education, that believed that they wanted the best for that practice, and that always invested in the team. And so for me, that's just how we do. That's just the way that it is. And I can tell you that 100% who I am today is because of how much that first doctor invested in me.
Wow.
Yeah, how much that first doctor invested in me, because I became hungry to know more. And I could talk to the patient about nerdy stuff like materials. I'm like, you have to understand, like, this doctor, when they left the room, here's me, the nerdy person, going,
"You got your nerd on."
Yeah, getting my nerd on.
That's right.
I would say this doctor has done so much education in the procedure that they're getting ready to do for you, whatever this is, right? Implants, whatever. And they only use the highest quality materials. In fact, they think so much of it that they want our whole team to go and we learn about the materials that they're placing in your mouth, so we can know that 100% that we're behind.
Right.
And the patient's like, "Are you kidding me? You all get it." Yes, we learn alongside of the doctor. And so we know the questions that we have the answers to some of the questions that you have. So you can have full confidence in our team.
Exactly.
So my doctor would take the whole team to Gordon Christensen. So even the front office. So
they have to understand.
Some doctors may say, "Why would you take the front office?" That doesn't even need to fit there, right? It doesn't fit.
Probably the MIT most important thing is the front office knowing exactly that answer. Who's getting the phone call? Not you, doctor. You're not answering the phone.
Yeah.
Sally up front is getting the phone call. And if she goes, you can read a smile on the phone.
Yeah, yeah.
And you can read you can read Eeyore on the phone, right? You've got Eeyore going, and an implant. But if you go, "Mrs. Jones, you're going to go to work the next day. Doctor's going to do a great job with our team. Going to get a couple of implants, no issues. I give my private cell phone out. to any procedure that has any involvement. Mrs. Jones, here's my private cell. Boom. You know how many calls I get?
None.
None. Maybe one. I should say maybe one a year.
So,
But that's
why
the
do you-
insurance policy that they
yeah.
want.
I mean, why do you?
High tech, high touch.
Yeah, true. So high tech and high touch, because if the patient feels like the team's all connected
All connect. Has
and
to.
they're all on the same page,
Right.
because I could come in too and be like, I don't know if that's what I would do. You know, like, I don't know if because there have been doctors I work with that I'm going, I'm not in alignment.
It's about finding the right people,
Yeah.
the right seat on the right bus.
Yeah.
And that wasn't the right bus for you.
It wasn't.
No.
And so, you know what I would put in the chart? Doctor recommends da 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 da.
Mm-hmm. Mm-hmm.
Hygienist opinion is da 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 da. I would cover my butt and I would
And you
initial
should.
it.
That's right.
I did.
You did the right thing.
I did.
Absolutely. Stand behind you 100% on that. Absolutely.
Yeah.
Yeah. And you know what? Your case acceptance will rise. If at high tech, high touch practice, you're doing the right thing, you're getting the right materials, your team is behind you. Our case acceptance on average runs about 91%,
Wow.
89, 91% roughly. And we track it. What gets measured gets managed.
Yep.
Very important.
And improves.
And improves. And I don't have to do anything about case management, practice management. Very little practice management day to day, because my team runs it. Because they're like, did you see our case acceptances in the 80s? Oh, that's because they get paid on that. They get a cut, win-win. You know, they get a bonus on number of new patients per month. They have to ask for new patients, because we always thought that, gee, if we did great work, our patients would say, oh, wow, that was great work. Not necessarily so. They think we're kind of all the same. Trust me, ask me how I know. So you have to say, Mrs. Jones, when she goes, wow, that was a really great dental experience. Mrs. Jones, you're a sweet lady. Would you please do me a favor and send me 2 people just as sweet as you?
Yeah.
And ask for that referral, because that's important. And that's how your practice grows, and grows organically, because there's that trust factor. You know, hey, Mrs. Jones sent me. She's really pleased. Can you do what you did for her with those veneers, whatever? Sure. Let's go.
Referral is just the best source
Absolutely.
that you can have as a referral.
Oh,
person.
absolutely.
Even better than even better than your 5-star reviews that your mother pushes the buttons on.
Exactly. But I mean, you know, from scaling and root planing, like that patient goes, you're done?
Oh yeah.
Yeah. Like, is that just the greatest feeling in the world?
Yeah.
Wait a minute. You're done? Yeah, we're done.
Yeah.
Yeah. And she's going to send her friends and her neighbors and her relatives, and they're going to just blossom.
Yes.
Yeah.
It's the practice that you want, and you're attracting more of that type of patient. So
That's correct. Yeah.
high tech, high touch. Give them your cell phone number. Give them Barry's cell phone number. I'm kidding, but no. Even he says, you know, when he says that he gives them his phone number, you mentioned it right after with what you said. That's a great insurance policy, because if they have
That's what I
access
tell
to you,
That's right.
they can't say that you never responded. They always feel like you've got them. That
I've got their back.
yes,
That's right.
they're in great hands. So that's that confidence. Again, it's about trust.
It's all about trust.
Yes.
It's all we have.
Yeah. Well, thank you, Dr. Bartusiak, for another great segment.
Oh, a pleasure.
Yeah.
Appreciate you so much.
I look forward to seeing you again soon.
Awesome.
And for our listeners, thank you so much for listening in, tuning in to the Dental Handoff. If you wouldn't mind going on to Apple Podcasts and give 5-star rating. Apple's what matters.
Boom.
Boom, boom. We're like fireworks. And then go on over to YouTube, like, subscribe, share. Thank you, Young Innovations, for your support. And we look forward to seeing you guys on the program.